Good to go? Yeah, okay, great. Good morning. Happy 14th of January. Good to see you guys. My name is Abby Stamp. My pronouns are she, her. I'm the executive director of Measure 110 here at our 10th, 11th panel review meeting. I don't remember which. Thank you to everybody for joining us again today. We are at quorum, which is great. And we need to do attendance. And then I have some announcements before we jump back in.
Okay.
Thanks, Carly.
Amy. Dharma. Keisha. Nicole Silva. Ron Williams. Seb.
I'm here.
Hey, Seb. Abby.
Here.
Ariana.
Here.
Ane. Dana.
He's coming in right now. Sure.
Okay. Was that Ane you said?
Yeah, Ane.
Okay. Dana.
I'm here.
Hey, Dana. Daniel.
Here.
Hello. Danielle. Drew. Elizabeth. She out today. Emily.
Here.
Evelyn. Grace. Gregory.
Here.
Greta.
Here.
Hannah.
Here.
John McElveen. Judith. No, I saw her come in.
Here. Sorry, it took me a second to get off mute.
No worries. Juliana.
Here.
June.
Here.
Kathy.
Here.
Kylie.
Here.
Kirsten.
Here. Good morning.
Good morning. Liz.
Here.
Mark. Maya.
Here.
Megan.
Here.
Michelle.
Here.
Nicole Corbin. Did she say here?
Yes, I'm here.
Okay. Nicole Eggeler.
Here.
Rachel.
Here.
Sam.
Good morning. Here.
Good morning. Sarah Adelhart.
Here.
Sarah Hubner. Sean.
Here.
Stanley.
Good morning. I'm here.
Good morning. Tammy.
Here.
Tatiana. Tim.
Here.
And we have quorum with 29.
Beautiful. Thank you, Carly. Thank you, everybody. We're moving along, and I'm feeling a lot of appreciation for everybody's willingness to keep coming together. We will come back together at 1 o'clock today. Our goal is to this morning, complete Jackson County, which is what we started on, I think it was late last week. I can't remember now if it was Thursday or Friday, and to revisit Hood River County. This afternoon, our plan is to revisit Deschutes County, Klamath, and Lake counties. So I sent out materials last night and again this morning. So let me know if you have any questions, but thank you in advance for pulling those slides up and engaging in the conversation today. A couple of quick updates. I wanted to share before we jump in together is just a reminder of our role and responsibilities for anybody who might be joining us online or live streaming later, is to discuss the applications that were provided for DTRSF funding for behavioral health resource networks, and to discuss with panelists who are here today who reviewed those applications any ahas or concerns, to make sure that these full funding recommendations do go to the Oversight and Accountability Council. We'll go over that again just in a quick second, just to assure everybody starts again on the same page. We will continue to be in this really hard space of making hard decisions because of the over $1.1 billion of ask and $427 million of funds available. Just simply affirming the incredible needs of services and treatment in the community. I'm sorry, I love a good dog moment. And so I did want to affirm that unless someone has an actual or potential conflict of interest, and for each county we will revisit our call for conflicts, I did confirm with our DOJ partners that it is an expectation that each panel reviewer votes yes or no. And if you do have a potential or actual conflict of interest, of course, please do abstain, as is indicated in the conflict rules. So if folks have ongoing concerns or like, I think it's yes, but that's something to simply articulate here, and to remind you all that we do have 2 people deployed from the Measure 110 team. Thank you, Nikki and Sarah, for watching our live stream and just documenting all of your concerns to make sure that that is well articulated over to the Oversight and Accountability Council. The other thing I wanted to flag for folks is we are in the process of changing how we come together remotely. We learned a lot over the holidays that if we don't have external support, we can't meet, and we're going to fix that. And so the Measure 110 team is getting trained on a webinar platform. We've got to figure out which one is the best option, and then make sure that we are sharing and communicating how to join, whether it's a Zoom webinar. I think there's a Teams option, just to ensure that, particularly for OAC meetings and panel meetings, that it's a format that is friendly for everybody and you can join and it's easy. So stay tuned for more information from us, from Carly. And in the meantime, many thanks to Britt and Jason for always supporting our work and making sure that it gets out into the public space as is required. We appreciate you. The other thing I wanted to say is a real gratitude. I had a quick check-in with Kirsten and with Jude and with Sam late last week, as we are always open to process improvements, just acknowledging how incredibly hard and cumbersome this process is, coming together and unpacking all of these applications. So I put it in an email last night, but I really want to thank the 3 of them for coming together to giving some suggestions for how to kind of pre-answer all of the ongoing questions about harm reduction and about housing and about peer supports and about Medicaid and whether someone's a CMHP. And that is information that you all have as both substance use disorder subject matter experts, as SUDSMEs, and also those of you who reviewed applications and can articulate information about how the applicant answered the question 7 around cultural linguistic competence. So I did put that in an email, and I will be asking those questions for start. And we are first going to revisit Jackson County using this process. So we rely heavily on you, the reviewers who are the experts on these applications, to lean in and share that information so that you all can take some notes. And when we get to recommendations, being really clear about what is being recommended and why, so that we can hopefully get to consensus on each county. It's going to be a little hard and challenging in these larger counties with so many applicants, but I do appreciate the suggestion of having a consistent way to elicit the same information, particularly when the conversations get so complex. Looking at my notes, I think I've covered all of the pieces. Oh, no, I didn't. There's one more thing. Just yesterday morning, I got confirmation approval about what information is going to be presented to the Oversight and Accountability Council. And I think we as a Measure 110 team are going to meet at the end of the day today to discuss how to do this, but there are 4 pieces of information that we're going to present to the council. One is information that was included in the applications but was not rated. The rubric did not give us a mechanism to rate past burn grantees and what those metrics or outcomes were. So there's the part of the section was the past burn information. And so we're going to share that with the OAC, who the current providers are, what providers are and are not reapplying, what your recommendations are from the panel review, and finally, a discussion amongst the OAC membership about which organizations truly are culturally responsive and linguistically responsive in terms of the provider and the services both being culturally specific and culturally responsive. So we will facilitate that conversation for the OAC to use those 4 pieces of information to make their final decisions. So that was approved yesterday, and that's the process we'll embark on. I hope this iteration of the OAC will have a couple of more meetings this month at least, so we can get to some additional decision making. Now, for real, those are all my announcements. Are there any questions or comments before we dive back into Jackson County? And I will share my screen in a second. No one's coming off mute, no hands. Okay. So let me go into Jackson County. I do want folks to unmute and tell me yes or no. If you want me to start at the beginning of the slideshow to kind of reset to where we were, or do you want me to dive right back in to the applicants and we'll go through each of the questions? Can we start at the beginning or dive in where we left off? Please speak. Let me know.
Can we dive in where we left off with the recipients?
Thank you, Hannah. Will do. And so for those of you following along on your other screens, we're going to start at slide 18. There we go. Everybody good? I see a couple of nods. Wonderful. Okay. So I've got pulled up here the questions to go over. So we are going to start at the beginning to be consistent. And I would love the reviewers who looked at addiction recovery services to answer the following questions. Okay. So folks, get your pens or your keyboards out or whatever way is best for you to keep notes. And the first question about Addiction Recovery Center is, are they the CMHP or the Community Mental Health Program in Jackson County?
Are you wanting one of the reviewers to answer that?
That would be if the reviewer knows, but I also know that that was not necessarily asked for in the application. So if there's a subject matter expert who can weigh in, that would be great.
Right. I reviewed Addiction Recovery Center and I'm not sure they did not specifically say that.
Yep, because that wasn't part of the application. So this was a request by said experts to elicit that information from this group. So who can answer? Yeah, Jude, please.
Hi, I'm going to put in the chat the link, but there is an OHA webpage that lists all of the community mental health providers. And so that website says for Jackson County that the CMHP is Jackson County Health and Human Services.
Okay. So I'm going to assume then where it's going to be a no for these first 6 applicants until we get to Jackson County. Great. Next question is, so back to you, Nicole. Can you please illuminate the full answer to question 7 that Addiction Recovery Center answered?
Sure, one moment.
Jude, your hand is still up. Did you have more to share?
Nope, it just didn't drop yet.
Okay.
Okay, so as far as Addiction Recovery Center, whether they are culturally specific, they only said they provide Spanish and LGBTQ plus specific groups. That's, providing that is not, as we had discussed before, maybe not enough, but that's all I've got.
Okay. Anybody else have other information about question 7 and Addiction Recovery Center? Okay. So we see that they applied for $173,000 in screening, $74,000 in assessment. And the question for the SUD services is, are the SUD services proposed outside of Medicaid billable services? For our SUD experts or our application reviewers, can you please weigh in?
Okay, I
Abby?
have.
Oh, sorry.
Okay.
I was going to say the fiscal questions 1 and 2 would give the first part of that answer. Fiscal and technical section.
Right, I was just scrolling to that. Okay, so I found 1 and 2. So yes, they offer services that are eligible for Medicaid reimbursement. However, they are only using the M110 funds to cover expansion and hiring more staff rather than service reimbursement.
Is that enough information, or is there need to have any discussion about that at $2.7 million? Okay. Thank you. So expansion. Moving on to the next, for peer support, Nicole, are the peer support services associated with SUD treatment, harm reduction, or both? And is it field or office-based peer support?
They do go out into the field. They have 24/7 mobile outreach. Well, they call it an engagement team. Go to a different section. Yes, mainly they go out into the community and connect people to other services, just using their peers and case management.
Okay. Thanks, Nicole. For our SUD experts in the room, is that enough information? Thanks, June. Okay. Nicole, thank you for being on the spot. I appreciate it. Unless there's any other questions, we're going to move on to Allied Health Services because Addiction Recovery Center didn't apply for housing or harm reduction. Any other questions before we move on? Okay, seeing none. Who reviewed Allied Health Services Tigard? We know they are, and this is me filling the space so you can pull up your application, is that they are not the QMHP. And we do need a full answer to their question about number 7. Liz, you're up.
Okay. For question 7, let's see. They scored a 2. They're not culturally or linguistically specific, but they do put a lot into being culturally competent. And they also have significant experience providing care and medication management for pregnant individuals.
Thank you, Liz. Daniel?
Yeah, apologies for the microphone. So yeah, I have in my notes here, let's see. Yeah, a little bit of exactly what it was just said, that the organization states providing cultural and linguistically inclusive services. It states in the application. And at the same time, I didn't see in the application or I didn't see them mentioning any alignment between staff and the people they served in terms of being culture specific and culturally responsive and language responsive, including staff with lived experience. It didn't really say much about that. However, I did recommend them to be funded.
Great. Thank you. Appreciate it. They did not apply for screening or assessment. So the question about SUD services for Danielle and Liz or anybody else who's a SUD SME is, are the services proposed outside of Medicaid? Or are they billable to Medicaid?
I put that the provider can and does bill Medicaid, and 110 funding would be used to expedite care for same-day access and to support uninsured or underinsured patients.
Anything you want to, oh, thumbs up from Daniel, thank you. Any questions about that? At 2.5 million? Okay, thank you. Moving on to peers, they did not apply, nor for housing. Question around harm reduction. What type of services? Is it mobile pop-up or is it a fixed? And do they are they providing naloxone, or what other supplies are they purchasing with the $6,400? Wound care, hygiene, syringes, etc.
My understanding is that they're purchasing like harm reduction kits to give to all of their MAC clients. So I don't know that it's necessarily a harm reduction program in of itself. I think those things could probably live under the SUD category. But they do provide a lot of data about why it's important to have those kits for MAT patients. And that's what they intend to do.
Thanks, Daniel. And any questions? Hearing none, thank you both. Boulder Care, back to Boulder Care. Who reviewed Boulder Care? We know they're not the QMHP, and who is available to read their answer to number 7? We don't have the reviewers here today. That is going to be the burden of probably Kylie and Jason and Kathy to pull up those applications and help articulate for us.
It looks like Nicole Silva and Danielle Cartwright were the 2 reviewers. I don't think Nicole's here, but is Danielle here?
Yes, sorry, I'm here. I was the reviewer for Boulder Care. So for the, let me make sure I have it. For number 7, there, again, as anyone who's done Boulder Care, they, they kind of have a textbook template response. But they talk about an organization-wide diversity and inclusion program that engages staff in ongoing discussion. They talk about the issues facing the patients, anti-racism, intersection of race and the war on drugs, language and education, community or criminal justice, and how it mishandles addiction and harm reduction principles. And then it also talks about the breakdown of the staff throughout the organization based on like how the staff members identify. So with that in mind, I did have in my notes that they met kind of all the components of what the question was asking.
Thanks for reflecting that, Danielle. Questions about that answer? Okay. Amy.
I guess for Boulder, we're on Boulder Care, right? For Boulder
Yes.
Care, I just really get concerned about their harm reduction as amount because, like we said, the naloxone's covered by medical, and you know they're a internet-based company, so I guess because they can bill for peer support too. So I don't know. I think we could look at their budget eventually, but I just think that that's a large ask when most all of their stuff that they do is billable services, and it's a telehealth pretty much based system from what I understood. And if I'm wrong, please let me know.
Okay, thanks, Amy. And we'll get over to the harm reduction to get more specifics about that in just a hot second here. So the next question after the cultural and linguistic response, Danielle, thanks for articulating that, is SUD. So it sounds like they are mostly billable, but the other questions are, is there anything they're proposing that is outside the auspices of being billed to Medicaid? So Danielle, sorry, you are way on the hot seat right now. And thank you.
Yeah, I want to make sure.
I also have Nicole Silva's response for these, if you would like that. They're all different. It's not the same response for each category. For recommendation, would you like her SUD response? Well, Danielle,
Yes, please.
Is that
So
helpful?
Before you dive in,
Yeah.
the question we've been asked to pose is, are the services proposed outside of Medicaid?
Okay.
If you can glean that from there.
Her response does not discuss funding that's outside of Medicaid. There is a recommendation, obviously, too. It is in green. The response is that there's realistic funding, there's expertise in subject matter, and they have a path to move forward with SUD. So that was the response. But
and based on their project scope or their budget, is there a way to ascertain whether they could bill Medicaid or whether these Measure 110?
There are notes for, in terms of like the supplanting question that might narrow it down a little. Applicant to first submit claims for reimbursement for clinical services to OHP. Standard Medicaid pays 37% of Boulder Care's cost of care, total cost of care. So non-covered services, personal support services, and care management. That's what is identified here. PSS, I'm assuming that's personal support services, but I might be wrong.
Danielle, do you have any other information?
Nothing additional. I pulled up the PDF just to confirm the full answer for in the fiscal narrative. And it's pretty much the same as was just read about the standard Oregon Medicaid fee covers 30% of total cost of care. And it doesn't mention anything specific about any other SUD treatment in Medicaid.
Okay, thanks, Danielle. Morgan.
Hey, I think that's a really important consideration. I mean, we all know what Boulder Care does. We've talked about the Oregon at length, but here in Jackson County, so if they're saying that Medicaid reimbursement covers 37% of what they do, that means they have a huge gap of 63%. And then the PSS there would be peer support services that they have integrated into their care. So what I'm hearing from that answer is Medicaid is, they always reimburse for Medicaid, but that these funds would not be supplanting Medicaid because Medicaid doesn't even cover half of their operations because logistically, to offer same day, like immediate MOUD, especially in rural counties like that through the telehealth services, that's just more expensive than what bare bones Medicaid reimbursement could offer. And I think that's maybe why we don't see other providers doing that when they're absolutely just bound to the rather low Medicaid rates. So I think it's pretty clear that they're not trying to supplant Medicaid. They're trying to supplement it so they can continue providing the care that they do.
Thank you, Morgan. Hey, Sam.
Yeah, a couple questions. What's the allotted amount for this county for money wise?
I don't want to tab back in my slides. Does someone have the formula available?
The formula is $24,446,277.72. I'll put the thing in the chat because everybody's not an auditory learner.
Okay. So you said 24 million roughly?
Yep.
Yes.
Okay. So we're 14 million roughly.
No, this is page 1 of 2.
Oh, okay.
Yeah.
All right. So we have these priority scores here on the right that we're looking at. I mean, we got to make some decisions and we got to, kind of do it in a timely manner. Boulder Care is, at a 9. On this first page, they're the lowest scored there. So, I mean, to me, it tells me that based on the application stuff, they don't rank very high in that category. I mean, I'm just saying if we're kind of discussing at length each one of these, we're never going to get this done. Now I'm not saying that we shouldn't have discussion about this stuff, but we got to be able to. It's got to move a little faster.
Mm-hmm. Mm-hmm. So, yeah, I know it's hard. Thank you, Zeb, and maybe I can try to help. So in the meeting I had late last week with some OHA SUD experts, there was a real desire to have the questions that I'm asking specifically elevated and discussed with each applicant in order to be able to make a thoughtful recommendation to the OAC. And so what I wanted to do is get these questions out beforehand so that the panelists could be ready and prepared to just, get through them and folks could take some notes. Like I've got this, janky but functional little chart I made on my notebook and kind of to tick through it. So for the folks who can reflect the answer to really try to be concise about what these questions are, because if we don't answer these questions, we're going to have questions about them in the end. So trying to get all the information out so then we can think about it and then get to some recommendations. And this is this is a hard county to talk about because there's so much desire and so many good proposals that it's really hard to do it. So because we at the Measure 110 team, Zeb, as you know, tried really hard to just simply reflect the objective criteria that was decided to use in the rubric, which is that priority score. There was a real desire to talk about specifically the culturally specific question, which was number 7. And so to really put the whole full answer into the space here so that the panelists could better identify whether it's a culturally specific organization, whether they tried to do cultural competency and provide linguistic services, or whether they refer to somebody else, that was really needed to feel like folks could make some authentic and ethical recommendations. So yes, I feel you, and maybe your energy can help kind of get folks ready and pull those applications up and get that information out into this space verbally so we can tick off some of these questions and move forward. What I'm hearing, yeah, go ahead, Zeb. Go ahead.
I just want to say thank you. I mean, to all the work you guys are doing. It's a tremendous amount of work that you guys are doing. So I just want to say that.
I know it is, and thank you. I appreciate it. And I'm trying to do a process that works for everybody, and thank you for your patience. So what I'm hearing, so I'll just summarize. What I'm hearing is that Boulder Care, yes, can bill Medicaid. However, it is wholly insufficient for what they're proposing to do. That's the $2.4 million for SUD. So I'm going to move on to peer support. So for Boulder Care, can someone please speak to whether the peer support is associated with SUD treatment, harm reduction, or both, and if they are field or office based, so that we can keep getting through this county? Danielle, I think that's you, right?
So the budget chosen, the funding goes specifically for personnel costs. But it does say it is associated with like the offering of the telemedicine for SUD treatment via peer support services. So the assumption of the hiring of peer support staff to provide the SUD treatment is where that overlap occurs.
And do we are these services provided telephonically?
Yes. And in their scope of service, it does also mention that they do provide like at-home visits when necessary, but primarily done remotely.
That's helpful. Thanks, Danielle. And to the last question about harm reduction, since they didn't apply for housing, is what type? Mixed mobile? Is it pop-up? Both? Wound care? What are they wanting?
So to my understanding, it is naloxone and the testing strips, and I believe it is I believe it's given out as part of like their treatment. I don't specifically see if there's like if they're doing any like pop-up. Maybe I missed it.
So it's $524,000 for naloxone and testing strips.
Yes.
Okay.
Yeah.
Questions from anybody? Okay. Make some notes. We're moving on.
Well, I have one more question, just real quick.
Yeah.
Sorry.
No, good.
Is there anybody physically located from Boulder Care in Jackson County that we know from the application?
Sorry, this is Ariana. My understanding is that Boulder Care is located in the Portland area and that all of their services are remote in every county that they have applied for, except for the Portland area, possibly. So it does seem that they have an office that they simply provide services from.
All right. Thank you very much. Appreciate it.
Any other questions about the service rate and harm reduction or any of the other service proposals in the Boulder Care application before we moved on to Family Nurturing Center? That's a cue for the Family Nurturing Center raters to be on deck. Okay, moving on to Family Nurturing Center. We know they're not the CMHP. Thank you, Jude. We needed a full answer to question 7 to assess their cultural responsivity. Jason, who rated Family Nurturing Center?
I was one of them.
Oh, great. Hey, Rachel.
So yeah, looking back, this is kind of where we left the conversation off last time. And I remember looking through and surfacing that their services are focused on peer support and trying to support parents into long-term housing. And so the bulk of their funds are for additional staffing to increase their services.
Hey, Rachel,
yeah.
I'm sorry to interrupt you. I'm just
Yeah.
going to facilitate pretty hard today. Can you
Yeah.
read the answer to number 7?
Oh, yes, I will. You're going to need to give me just one moment to pull that up. I apologize. So the answer to number 7, Family Nurturing Center is not a culturally specific organization, but we do work diligently to be culturally responsive. FNC is committed to the equity and success of each family. This commitment means that family success will not be predicted on race, ethnicity, economics, mobility, gender, sexual orientation, disability, or initial proficiencies. FNC strives to provide a barrier-free environment in which all families can benefit from FNC services. To meet the needs of our community's second largest population, FNC employs bilingual staff and provides all materials in both English and Spanish. For all languages not supported by a staff member, FNC utilizes a language line and interpreter service.
Thank you. Appreciate it. All right, so I hope folks are taking note about that. So a full answer and also disclosing they don't identify as a culturally specific organization. Family Nurturing Center applied for screening, and we have the total amount there. And the next question I have been asked to facilitate is through peer support. Are the peer support services associated with the SUD treatment, harm reduction services, or both? And are they field or office based?
So I do believe that some of that is mobile based because part of the funding they're asking for is to allow their staff to kind of meet their parents in the community. So that is one piece of it. I'm unclear about the SUD based piece. It doesn't, let me look in their scoring piece here. I'm not seeing anything about the about any SUD treatment in their application materials.
Okay. And so for 1.64 million, how would you summarize the peer support? Is it
primarily staffing? So it's going to hire 4 certified recovery mentors and partial staffing among a peer support supervisor, some parent anonymous facilitators, and a long-term. Oh yeah, those are the peer support staffing. There is between $22,000 and $26,000 a month for benefits associated with that. And then the thing that I called out as a concern potentially was there are between $33,000 and up to $38,000 per year for fringe, which is no explanation around it. So just within peer support, that's over $142,000 in fringe with no details about what that money is allocated for.
Okay. Thank you. Potentially health insurance or other things that their employees may need.
The other piece I would say is there's mileage and some program expenses, roughly $30,000 a year, starts out $28,500 and goes up to $32,000, which are delineated as emergency money for waitlist, food pantry, just sort of a combination of program related expenses.
Okay, great. Thank you. And the last question is around housing. And it sounds like probably the peer support's really supporting that the housing program? Actually, I don't know. You can tell us. And is it housing first? Is it emergency housing? Transitional rental assistance, permanent?
So there's $120,000 a year for rental assistance built into the housing budget. That's the bulk of the service and supply costs, with additional, just some like program related food pantry kind of supplies, mobile phone costs, and then the rest of the bulk of the cost is around staffing. So 2 FTE housing case managers and some partial housing supervisor and case manager benefits there, or staffing there.
Thank you for reflecting that, Rachel. Kathy Cervantes, you're on deck for Golden Rule reentry. Any questions for Rachel or other comments about Family Nurturing Center before we move on? Hearing none. Golden Rule reentry, thank you in advance, Kathy. We know Golden Rule is not this CMHP. They did not apply for screening or assessment. We do need an answer to question 7. And Ariana, do you want to jump in now, or go ahead?
I do have a question. It's a journal question. I'd like to get a feeling on whether it would be better to skip folks that have not been recommended by both reviewers, because reflecting Zeb's time concern.
Yep, it is a concern. And my goal is to go through each provider, because the questions are going to be, why weren't they recommended? What were your concerns? So that was my thinking based on the information that we had before. But what that, actually, thank you, Ariana, for people who, please, and this is why it is really hard to facilitate with so many cameras off. And if you are in a space where you just can't turn it on, that is okay. I totally get it. But I'm trying to usher us through this in a thoughtful and quick way. Thoughtful and quick usually do not work well together. So my question for you all is, do you want these questions to be asked of every single applicant? Will that be helpful as you ponder it to make recommendations, or do you just want to look at the folks who have both been recommended? My understanding was that we really need to thoughtfully at least touch on every application to get a sense of the scope of the applications in each of the counties. So could you folks weigh in and tell me what you prefer so that I can facilitate us into the next phase of this conversation? What are your preferences?
Abby, I wonder if we could, on the ones that are no's, read the reason for the no in the application. Because to say no, I would think someone would have to document pretty clearly why they were saying no, because most of them are generally yes. Maybe that would be a place to have a summary that might be helpful.
Can I get some?
Is Dharma here?
Dharma is not here.
I have Dharma was the other reviewer on this golden entry, and so I have the responses for the no recommendation for SUD.
But before we get into that, I just want to be, I'm trying to honor all of the requests for how we get through this process together. And there was a real desire to understand how the applicants articulated their ability to be culturally responsive and culturally specific, and the scope of work that was proposed, whether or not the applicant was recommended by both reviewers or not. So what I'm trying to understand is what the consensus is of this group so that we can have the right amount of information present to be able to make recommendations. And I'm happy to skip over the folks who are not recommended. I'm just concerned that by the time we get to the end of reviewing everything, it's like, well, what about those guys and what did they do? And I'm also going to have us have about 3 minutes of this conversation, and then we're going to move on. Amy, you're first, then Jude, you're next.
I think just a brief explanation as to why. We don't need to go into detail. That way everybody's satisfied with their no on the ones that weren't selected. Because if we want to dive into the weren't selected, we're wasting time. And we don't have time. These people don't have time. Addicts dying out there because we're sitting here being meticulously you know, when we're not even the ones making the final decision. So I think we need to kind of take that into consideration and move things along. I do appreciate wanting to know the no. So let's summarize that briefly and let them know. This was not selected because of this, but we don't need a breakdown when we're not even gonna, they didn't even get selected for funding. I mean, you're wasting time. If you look at every few minutes that somebody overdoses, that's what we're wasting.
The only concern I think to be considered is whether or not hearing why one of two people were able to knock an applicant out. Would this be a justifiable appeal if we don't understand how they were? That's my only concern. And I hear you, Amy, about moving fast. And we also need to know that this is multiple years of funding.
Well, that's why I said we could summarize the no's rather quickly. It's not needed to be a debate, but at least we've heard why, and then we can move on.
Ariana?
Just to point out that we do have an appeals process for this reason. I don't think that it serves us well to second guess who may or may not appeal at this point in time before the OAC even votes. I do hear the concerns.
Looking at the applications, let me tab to the next page. There are very few folks that were not recommended. This is my ask, and I think we can do it. I really need you all to lean in hard and to be prepared to speak to the applications that you rated. That's why we're here today. So if when I am trying to give folks a flag, you know what's coming up next. If you could be ready to just jump in and answer those questions, take some notes so that we can really be transparent about our process. And there are so many yeses and so few no's. I think we can knock this out pretty quickly. So my favor is, and this is a big burden on Kylie and on Jason and Kathy, I appreciate you guys so much, that we need to get through the questions, because there will be questions, we need to be able to answer them. So the goal here is to try to answer them before they're asked and ensure that we are elevating all the information. So the more we can all be present and lean in and get through this, the better we will all be in making good decisions. Unless there is like, Abby, are you kidding me? I will pivot. But if this feels okay, we're going to do that. And I'm going to give a pregnant pause to see if there's any concerns about me facilitating us through this pretty hard and fast to get through Jackson County in the next hour. Means y'all are going to need to have all your screens open, get your applications open, be ready to respond because there will be questions. Okay. Waiting. Awesome. We're in this together, people. Okay. We are on Golden Rule reentry. We know that Dharma and Kathy were the raters. We know that there was one yes and one no. We know that they're not the CMHP. Did their application, Kathy, can you summarize what they said in question 7? So we know if they're a culturally specific provider at all.
On question 7, the cultural community our services are primarily designed for and delivered to is the formerly incarcerated, who are becoming recognized as a distinct primary population along with BIPOC, LGBTQ, non-English speaking, veterans, women's, Native Americans, and people with mental and physical disabilities. The formerly incarcerated also include people from all of the above categories in higher numbers than the general population. We have a fluent Spanish speaker on staff and funds set aside for interpreter if needed. As organization, we are committed to anti-discrimination, and our board and staff are composed of people with lived experience as well as LGBTQ. I did not give them a full point on that. To me, they could have done more than just Spanish speaking. And I didn't see anywhere where they reached out about, gave any more information about tribal affiliations or connections. So that's why I rated them on a 1 for that. I'm not sure what Dharma did. Yeah.
Thank you. Can you, the question about SUD is, are their services proposed billable to Medicaid?
I show that they did not apply for SUD on here. It says, I said NA in there, which means that they did not select it on their attachment A.
Okay. Must have been that Dharma indicated that perhaps they did, but the dollar amount is still zero. So let's move on to peer support, which is what are the services associated with? Field.
They
office.
do a lot of extra training on peer support. Most of their peer support is not external, out on the field kind of peer support. It's directly related with those that have been incarcerated and that are re-entering into the community. So that's where their high level is going. Based on the project scope, I see this as a viable selection to assisting formerly incarcerated individuals. This seems like a well-rounded organization. However, I did read Dharma's no on that, and she was really looking for more external and more outreach for that. That's why we disagreed on it.
Thank you. Last but not least, they did apply for housing. Could you speak to what type of housing is proposed?
They had some detailed step plan for those released from incarceration and lots of training. Even the relapse plan was in place. They have drop-in centers. I was trying to find where that's at in their project scope. My apologies. I was focused on the cultural one. Excuse me. The community need identified in meeting GRR had with community justice director and was housing and housing, basically. Per the data from Jackson County, they were looking at the disproportionately higher than in other counties, the arrest rates, and that they were looking more for helping those people that re-enter and find housing, temporary housing.
Okay, the clear lane is just as involved folks who are coming back to
Correct.
the community. Okay, great. Any questions for Kathy before we move to HIV Alliance, which is Sarah Adelhart? Great, no questions. Moving to HIV Alliance, we know they are not the CMHP. Sarah, how did they answer question 7?
Sure. Let me pull it up here. So for question 7, we have all services at HIV Alliance are culturally and linguistically responsive, see section 8. And some are also culturally and linguistically specific. HIV Alliance works with culturally specific community-based organizations to offer services specifically for BIPOC and LGBTQIA+ people. For example, HIV Alliance staff provide information/education at Medford Pride, and through this funding may expand to offer testing in naloxone at Pride. HIV Alliance currently receives funding from the CDC to provide services to BIPOC people with use disorders in Oregon. We have staff and offices based in the rural communities that they serve. We also employ many bilingual staff to accommodate Spanish-speaking communities, and our staff have access to phone-based language interpretation. We also provide access to ASL interpreters.
Great, thanks, Sarah. And they applied for screening, but no money. Can you summarize with housing, what type of housing they want to provide?
So
transitional.
I don't know if maybe I'm not connecting dots, but what I'm seeing on the slide is not what I see in their proposed budget on the worksheet that they submitted.
Okay. For housing or harm reduction or both?
All of it looks weird. I don't know if I just am rusty from not having to present one of these in a couple meetings, but the numbers don't look right to me.
Okay, I'm glad we're going over this. Jason, what do you see on your end?
One moment.
I have it pulled up, and I do see that there are funds in the screenings part, which should be $89,791.10.
Oh,
Yeah, I was going to say it's definitely not $0.
No, it's not $0.
The other two numbers look correct.
Yeah.
I believe, but yes, it does look like the screening cost didn't get imported correctly.
That is not good. I heard 89K.
89791.10.
And 10 cents.
Okay. Yeah, and then the other two
The other two
are
were good.
accurate. Yeah.
Okay.
And then yes, that's the program cost listed as well. Okay.
So
Cool. I
thanks.
thought I was losing it. Thank you.
No, not at all. Can you share housing? What type of housing they are proposing?
Sure. Let me also review that. It looks like what they've done in their proposed budget is anticipated housing assistance, but also transportation assistance, cell phone access for peers to give out. And yeah.
Okay.
That's
and harm reduction.
Correct. Yes, they, let me get to the section where, yes, they are able to see folks in the community. And also in terms of you need to know the hours too, right?
The question is, what type of service? Is it mobile, or is it pop-up, or is it mixed? And then also wound care, hygiene, syringes, or other supplies for harm reduction.
Yeah, sorry. Their application, they've got their responses kind of scattered throughout all of the questions. So they've got, it looks like they're able, you have to forgive me, I'm not as familiar with like the harm reduction world.
I have information from the harm reduction off their proposed budget.
That'd be helpful. Thank you.
Harm reduction supplies will include naloxone kit supplies, and rapid tests for HIV, hepatitis C, and syphilis. Costs are calculated based on annual goals and typical annual costs for this county. A vehicle for harm reduction educator position will facilitate delivery of mobile partner or location-based harm reduction services and information education for PWUD and the general public as various locations in Jackson County. This vehicle will improve program capacity to provide and expand access to these services, enabling the harm reduction educator and assisting program staff to reach more at-risk communities across county directly where they're at. These costs are directly related, necessary to provision of proposed program services. This vehicle is directly related to necessary provision of proposed program services.
Okay, thank you. Any questions about that before we move to Jackson County? And that is Ane and Ariana, you're on deck.
So they are the CMHP. For question 7, they said that they were committed to ensuring that clients are provided harm reduction services that are culturally responsive and linguistically appropriate. They're gender affirming, and yeah, so that the answer to that question was yes. They can bill for Medicaid, but the harm reduction services provided under Measure 110 are not direct services, and so they're not qualifying for Medicaid or insurance reimbursement. They have a mobile harm reduction, and they've included like a whole list of supplies, wound care supplies, educational services, and rapid testing. I can go into those if anybody is interested.
Thanks, Ane. Ariana, you also reviewed this, and I note that Neither of you recommended for funding except for harm reduction.
Well, yes, because the $16 amount is one that we've seen come up as an error in the addition process in our budget spreadsheet. So fundamentally, they're a mobile program. They go out to remote parts of Jackson County and they do a syringe exchange. That's what it's built around. And they do offer other harm reduction services. Nowhere in this do I see naloxone listed, but I do see a lot of other really beneficial things, safer sex supplies, health education, testing, linkage to care and resources.
Okay, thank you. Thanks both for summarizing. Does anybody have questions about Jackson County Health and Human Services, the QMHP, who has been recommended from both reviewers for funding harm reduction at just almost 1.7 million?
If I can just note that, so I said yes to recommend funding. They are part of the CMHP. They are an established syringe exchange program. This was my first application that I reviewed, so I wasn't really aware of like the amounts that folks were asking for. Considering the overall, like the over budget total, I would approve the funding, but have like a second look at the budget.
Okay, Jude, you had your hand up. No questions?
No.
Okay.
I did want to point out, may I point out about them that I had concerns around how they answered the questions about linguistic and cultural services, in that they were extremely vague in their responses.
Okay. Thanks for sharing your concerns. Any other questions about Jackson County Health and Human Services? La Clínica del Valle is next. Just Stanley and Grace. Hearing none. Thank you. Moving on. La Clínica del Valle. Stanley was here. I think she might still be here.
Yeah, I'm still here.
Awesome. Thank you.
No worries.
So we know La Clínica is not the QMHP. Can you read their answer to question 7, please?
For number 7, it was really detailed and there's a lot. So I'm just going to tell you that they are culturally and linguistically provide services and gender affirming, because it's very detailed. Very.
Great. Any questions about that? Seeing none, moving on to what they applied for screening. The question was, we need the full amount, and that is $2.248 million, assessment at $294. And for SUD services, Stanley, what are they proposing? And is it, sorry, not what are they proposing, but is it billable to Medicaid or not?
Yes, they're eligible to bill to Medicaid and other insurances.
And is what they're proposing billable or not? Like serving uninsured folks or the
I'm looking, and it is both. They are providing supports to everyone that they have a walk-in clinic. So it's anyone who's able to just walk in.
Okay.
Same day access services for SUD care.
Any questions on that before I move to harm reduction? Okay, harm reduction. What type of service are they proposing?
All right, they're proposing education at no cost, fentanyl strips, wound care, harm reduction information and education, as well as SUDS, infectious disease screening. And they also share that they have reached 400 individuals in the last year and hope by the next 4 years it'll be 8.
Thank you, Stanley. Before we move to Max's mission, and that's Tatiana and Greg, are there any questions about the scope of services or any of the other information that Stanley reported for La Clínica del Valle? Thank you, Stanley. Hearing none, Max's mission. We know they're not the QMHP, and is that Greg? I think you are the only reviewer here. Can you read their answer to question 7?
Yes, I can. Let me just bring that up real quick. Yes, their answer to question 7 is, we aim to provide culturally competent care. All our educational material is available in English and Spanish, as well as ongoing continued education for our workforce to increase our cultural and linguistic understanding. Utilizing these funds, we will also be hiring a bilingual peer to help us increase our cultural and linguistic services and overall cultural capacity. Our services are tailored to the counties we serve and the cultures of those communities. We currently have a peer in spoken and written Spanish, as his heritage is culturally diverse. We also have a harm reduction peer who can provide conversational Spanish.
Thank you for that. Their application is for peer support. Could you please articulate whether they are associated with treatment, associated with harm reduction, or what parts of their programming, and are they in the office or are they field-based?
Well, they don't provide any Medicaid billable services, and their peers are harm reduction.
Okay.
They do have an office in 3 counties, and we'll get to the Klamath one, I guess, this afternoon, but they are out in the field quite a bit. They are not a housing provider. The harm reduction is mobile in a sense, so they provide syringe exchange, safe use supplies, naloxone, drug checking supplies, wound care, hygiene kits, water, food, blankets, foot care, dog food, and seasonal support. Many of the people we serve are unhoused and often living in unstable, precarious, and even sometimes dangerous situations. Annually in Jackson County, as of 2023, we've served 7,623 people.
Thank you, Greg. Any questions about Max's mission? The $3 million for harm reduction and 1.1 for peer support. Questions about that? And on deck is Oasis Center of the Rogue Valley, which is Zeb and Greta. Okay, Greg, thank you. Appreciate it. Moving on to Oasis Center, we know they're not the QMHP, and we need an articulation of how they answer question 7, please.
I can go with number 7. Their answer is, those Oasis Center recognizes that most effective supports take place within a culturally and linguistically reflective environment. Not only are Oasis peers and staff connected to the community, but they also reflect the experience and complex challenges of pregnant, postpartum, and parenting people using substances. They're offering support to population disproportionately impacted by stigma, societal judgment, policies criminalizing substance use. The Oasis peer doulas have lived experience with pregnancy, parenting, SUD, navigating child welfare and criminal justice system. Additionally, they offer interpretation services in the forms of Spanish. All 3 of their medical providers speak Spanish. That's for number 7.
Great. Thank you, Zeb. And they're applying for all service areas except for harm reduction, screening at 250, assessment. One of the 2 reviewers said yay, another said nay. We can verify that there is a $0 ask there. And the question then is about, are their services billable or not to Medicaid? What can you tell us, Zeb?
Yes, it says the Oasis patient panel is approximately 87% Medicaid.
Okay. And was it Greta? And is Greta here?
Yes, I'm here.
Hey, any other information you want to put out into the space today about Oasis Center before we move to specifics on SUDS, peer support, and their housing?
Just that, no, not really, no.
Okay. All right.
I have one more thing I just want to add though. The program costs is like totals like 907,000.
Yes.
And a large portion of that appears to be the executive director wages. So I just want to, and per year, it's like, this isn't necessarily the wage, but this is what they're would be getting 277,000 basically for the first year, roughly around the same year after that. Anyway, I just wanted to make a note of that for the program costs. I think that's kind of high. Thank you.
Yep. And the panel is interested in having specific information about Oasis Center, the Rogue Valley, and their SUD treatment at 1.4. What are they? You said they can bill Medicaid, but 80% of their clients are Medicaid insured. So do we have a sense of, is their ask the 1.4 for the other 13%, or what Medicaid doesn't cover? Is it clear?
To me, it seems like when you look at the budget, the SUD treatment is supporting a lot of staff. They're supporting some medical assistants, a phlebotomist. So that's kind of what those funds are going towards. And they're going to probably, they did talk about in their application that they, some of the services, the MAT services that they provide are very high cost and that not always fully covered by insurance. So they're using the Measure 110 funds to cover things that aren't covered by Medicaid or those that are underinsured.
Thanks, Greta. Sam?
Abby, this is on Oasis, right? Center?
Yes.
Greg, help me on this. They would be unable to bill Medicaid, right? Based on how they are structured right now. Is that right?
That is correct. Unless some OARs change pretty soon, I think is going to happen, but currently that is correct. Yeah.
Right. So they, this is a integrated physical and behavioral health care program that prioritizes pregnant and postpartum women with a substance use disorder and provides a full continuum of care with partnerships as well as the internal staff. So everything they do right now, until we figure out as a system what an integrated model can look like from an insurance standpoint, from a Medicaid billing standpoint, is supported typically with grant funds or pilot programs that we've done. So the money that they have listed there, I don't believe anything could be billable. Okay. And then one last thing is just seeing the screening amount, appreciating that they do screenings for folks who walk in their door, absolutely a comprehensive screening, but just want to note that I'm not clear that it would that they would be the screening doorway for anyone and everyone within a burn, if that makes sense.
Yes, their population. Got it.
Yeah. Thank you.
Thank you, Sam. Seb?
Yeah. So I have a question here. So you're saying they don't build substance use disorder treatment? Sam?
They don't, Seb, and I think it's because they have not gone through, because it's a physician, right? It's a family practice that has behavioral health integrated. So they don't have like the certificate of approval. They don't have all of the sort of behavioral health check boxes that you would need in order to do that. And I think like with peers, the OARs don't allow for peers in that setting. I mean, I think that could change down the road, but and I know Greg, sorry to keep calling on you, Greg, but I know you work with them one-on-one more.
Yeah, I mean, what Sam said is right. And I think they're working on being able to get the peers covered, but right now you have to have a COA to bill or work under a COA to bill for those peers in a medical setting.
Okay, any other?
I don't want to put a wrench in that, but none of that information was included or even stipulated. It wouldn't even have like caught our attention from this application. So I guess I'm a little disappointed in the application not being very thorough in really explaining their services because they really look like they can bill Medicaid. They didn't talk about any hardships of not being able to bill Medicaid and being fully grant funded. So I'm just kind of disappointed in the application in that stance as a reviewer of this one. I feel really deceived in a way.
Well, and I agree with that because here we are reading the application and that information is new to us. So I agree with that.
Thank you both. Shall we move forward and summarize the said services we already know there were questions, now we have lots of clarity. Can someone quickly please summarize the peer support and whether those peer supports are in the field or office-based?
So as mentioned, this really is application does demonstrate the continuum of care and that these things are interconnected together. So the peer services are a lot in their clinic and a little bit in the community. And their housing services is a partnership with OnTrack in providing emergency housing for those that are waiting to get into SUD treatment.
Thank you. And because we have a room full of experts, I was able to just take a look at Emily's comment, and I think we need to speak to it real quickly. And maybe Sam, you can help unpack this since it was before my time with OHA in terms of having application reviewers who are SUD experts and then having so much more information and knowledge about these providers and the current state of service provision and the continuum of care in different counties, how we should ensure that we are walking the right line in this conversation here today when there are value-added comments that are outside the scope of what was presented in the application. Maybe Sam or Shannon, I just want to make sure that we are in lockstep and doing this thoughtfully and ethically. I'll start with Sam and Shannon, then Amy, go ahead.
The only thing I would say is I think that the question for me was around, can they bill Medicaid? And that feels like something we've been asking of all the providers. I mean, in terms of whether or not they answered the application fully, only the reviewers would know that, but we have been trying to determine whether or not they can bill Medicaid outside of even applications, I think.
If I was going to answer that question again, really looking at the application, I would say that they, when Zeb talked about 87% Medicaid population, I think that was for primary care services. And it does stipulate here that a significant portion of Oasis services vital to maintaining client SUD recovery are not billable. And then they go on to include stuff like childcare and stuff like that. So it kind of does say that they do not bill Medicaid for SUD if you can read between the lines and really know what they're saying. If that, to answer the Medicaid billing question.
Thank you. Amy?
Are they a past Measure 110 recipient?
Yes.
Yeah?
Yes.
And they're still not able to bill? Okay. It just concerns me that they didn't get their COA done in the last 4 years. You know, they could have been billing for this stuff and they didn't put the effort in to get certified like everybody else did as being part of the burn. So that's concerning to me.
Shannon, you can go first and I'll go after you.
Okay, thanks. And so it's Shannon O'Fallon with DOJ. Sorry, my camera's again not cooperating. I think from my perspective, what's important is to understand, right, the application criteria. And so the review panel shouldn't be bringing in information that is at least external external to that criteria that's in the rules. And so I don't know if people, sort of have that at their fingertips, right? You need to make sure that everyone's being treated the same and the same kinds of information are being assessed as decisions are made.
Thanks, Shannon.
Thank you. I'd just like to say too, to follow up on Amy, I mean, if they're applying this much for SUD, $1.4 million, and they can't bill Medicaid for that, I mean, that is a concern that they didn't get certified to do that.
Thank you for flagging that. I think we have talked a lot about Oasis Center of the Rogue Valley, and just to remind folks, if the entity is highlighted in that goldenrod, that means they are a past burn grantee. We're going to move on to On Track. Thank you all for the conversation, and that is Amy and Hannah. So the first question we know is On Track is not a CMHP. I would love one of you to please read or at least relay the answer to question 7.
On Track, this is Amy. On Track is Medford outpatient housing, is culturally responsive to Spanish, English, bilingual services. They really are specific on their Spanish, English provision. They do go on to talk about, culturally responsive to LGBTQA and other things like that in a different area. But for that question, number 7 is short and sweet.
Thank you. Their screening application is for $28K and assessment for $754. So we have SUD, and are the SUD services proposed outside Medicaid billable? Amy or Hannah?
They are billable services, and they can they bill for Medicaid peer services that have been prescribed in service plans. So they can bill for, I'm getting ahead of you myself, sorry. Yes, they can bill for SUD treatment. Okay.
And with the $304,000 proposal, what is that for?
Okay, so when it went over here, I'm sliding across here. This funding will support our CADC, CADCR staff that are embedded at community partner sites, so they're part of a burn. CADC are currently on site with Public Health, Community Justice, and Las Clínicas. Low barrier Oasis. They work with a bunch of them. They go into the jails. Most of their time is unbillable as they are on site, building relationships and engaging with potential clients. Our mobile assessment services is highly utilized by partners, as we can help get someone on a wait list for detox, residential, emergency housing when indicated. This would not be sustainable without the funding from ballot measure 110. The assessment numbers indicate the predicted number of assessments. So yeah, that's what that ask is for what they do.
Yeah, and I would just share that it is for their emergency lodging, so providing transitional housing and key staff to support that work. Their peers are out in the community, and they do community outreach with their peers, and they intend to hire, I think, about 8 peers. And then as far as their SUD, as Amy shared, it's supporting their transitional housing, and then also expanding their CADC. One thing that was integrated in their proposal is their request to fund an AI tool that will help the CADCs and peers translate progress notes. And with 14% of Jackson County's population being Hispanic or Latinx, they serve about 20% of that population. And so they really did echo that their intent is to provide responsive services both in Spanish and English.
Thank you. Thank you both. So you covered their cultural responsivity answer, the SUD a bit, peer support and housing. Any other details you want to add about, you indicated what type of housing it is, but the peer services and whether they're field-based or office-based and how they're integrated?
Peer services are both brick and mortar and a community base. And then they have peers that integrate through the housing as well.
Okay.
From what I read. As a reviewer, can I say what okay. So as a reviewer, I looked at this. I think that I approve this, but I really think their budget needs relooked at where they have so much that they can bill. I think they could, if we needed any adjustments, it could probably be made to these areas of SUD, assessment SUD, and some peer, especially the peer support. I know they're hiring more and they want to do more, and that's great. But peer services are billable if they're put into the treatment plans, and they know that. So, i.e., in essence, they can bill for peer services, some of it. I'm not saying all of it, but I put in my recommendation at the bottom that they have a strong application. I just feel like their budget needs a look over.
Thank you, Amy. Hannah?
Yeah, I agree that their budget is really high, but the program, the scope of work was well addressed. And as far as like with the SUD component, they also do want to purchase like storage units for those individuals in transitional housing, so that way they have a place to keep their belongings. And so majority of their, I feel like the costs are, about 50% of their services are billable to Medicaid. The items that they address in their proposal, such as the storage units or vaccinations for individuals like companions, that's in there, and then harm reduction is kind of integrated in the transitional housing component, and they provide wound care supplies, disposal containers for sharps, and Narcan for emergency lodging guests.
I also like how their budget ask for harm reduction is small because they partner with the community mental health, but also because it's little welcome kits they give people, like, hey, we understand, here's, your harm reduction welcome kit, and get people, coming in the door. So that was kind of caught my eye.
Great. Thank you both. Any questions before we move on to options for Southern Oregon? Dana and Ariana are on deck. Any questions? And we are at 11:37. I remain optimistic. Okay. Options for Southern Oregon, current burn applied for SUD and perhaps peer support. We can get some clarity there. They are not the same HP. What is the answer to the cultural responsivity and specificity question, please?
They were really clear about this, and it's impressive, actually. They provide services specifically for the LGBTQ plus community, individual services and groups. They have the vast majority of their community has English as their first and primary language, but in their staff, they speak Spanish, Portuguese, German, French, Vietnamese, Russian, and Ukrainian. So they are well positioned to translate to just about anybody. They have a great background in providing trauma-informed service. They serve all kinds of, they serve parents also with children and intellectual and developmental disabilities.
Thanks, Ariana. And for their SUD application at $678,000, what types of services are proposed, and are they billable for Medicaid services? Are they Medicaid billable services? That's how I wanted that to come out.
I'm going to be blunt and say I don't know. I don't know what Medicaid is what can be billed to Medicaid or not. That's not my area of expertise.
Dana, are you here? See her. So, because we have some experts in the room, would it be helpful to quickly detail or at least list what they want to accomplish, and we can see if they're billable? Maybe there's some insight. Oh, Dana's here, but issues with unmuting. Okay. Maybe you could try to put it in the chat because that's what we got. And Jude, your hand's up.
Oh, I was just going to say, can someone read the fiscal and technical narrative, question number 1 and question number 2? That's where you're asking about Medicaid and health insurance reimbursement.
Yep.
I have that pulled up. So question number 1, our organization offers services that are eligible for Medicaid and other insurance reimbursement, and we have the ability to bill Medicaid and other insurances. We have contracts with both CCOs in our region and procure and maintain provider contracts with a wide variety of private insurance companies, such as Blue Cross, Pacific Source, and also TRICARE for the military, veterans, and their families. They do give some examples about Medicaid-assisted treatment. And question 2, it is standard practice that all our services that are billable to insurance are billed as an integral part of our system and funding. However, everyone is able to access behavioral health services and supports, even if they are uninsured or underinsured. When individuals enter into treatment services, insurance information is gathered and billed in every situation where the service is eligible to be billed. Services that are not covered by insurance are provided and then funded via other means, such as through BURN funding. Our BURN application focuses on services and supports that are not reimbursable through insurance.
Thank you, Kathy. Questions about that? Dana, see how it's...
Can you hear me?
Yes, I can hear you.
Okay.
Awesome.
So sorry, everyone. I apologize.
No, thank you for fixing it.
Yeah, so Kathy did a great job of reading and summarizing kind of their efforts in regards to ensuring that the services and supports that they provide are billed appropriately when able. The budget is really about funding 1 full-time peer specialist and 1 full-time case manager, and this is for their mobile services. So it's going out into the community, and a lot of time that's services that aren't necessarily billable to insurance. So I feel comfortable saying that this small amount of $678,000 is really going towards services and supports that are not billable by other insurance. But I am confident that when they do have services and supports that are delivered and covered by Medicaid or any other insurer, that they will access those funds.
Thank you, Dana. Are there any questions, follow-up questions about Options for Southern Oregon and their application? And for Oregon Recovers, Daniel and Garcia and John McElveen. I don't think John is here. And Daniel, are you still with us?
I am here.
Hi, there you are. Hi.
Hi. Yeah,
I don't hear any questions for Options for Southern Oregon. I'm just kind of giving it an extra couple of beats here. And okay, you are back on deck. We know Oregon Recovers is not the CMHP. Could you read us their answer to question 7?
And you know what I just realized here, Abby, that I did not score their peer support because they're applying for both peer support and harm reduction, and for whatever reason, and I cannot remember why, I only scored the harm reduction. So huge apologies for that. So I don't know what would be the best practice to do here. I can go back and review this and send you a new scoring, or if there's the other reviewer, so the peer support piece, I don't know what to do here.
If you need a few beats to go take a look at that, I don't see your name on the rest of these applicants. I'm wondering, actually, I don't know in terms of what my gut says might not be the right thing to do. So I'm looking at you, Jason, for some feedback, but I'm thinking if you could take a minute and go do that, and then maybe by the time we get through youth era, you'll have some.
I can totally do that. Now, for just to answer those other the two questions about whether they bill Medicaid, they I believe that they don't. Let's see. Yeah, they do not offer the services of billing Medicaid, and I'm talking about the harm reduction, and I can always go back to the other one, but I actually recommended as a no in harm reduction. So I can always go back and give you something more detail as you suggested.
Jason, does that make sense to you in terms of process? Yeah?
Yeah, it does.
Okay.
I can totally do that.
Awesome. Thanks, Daniel. So thank you for that. And I think, so John's not here, so we'll just we'll punt Oregon Recovers to the end. I need to write this down so I don't forget. And then we're moving on to Painted Horse. Got Kylie and Danielle for Painted Horse Recovery. If you could share what, we know they're not the CMHP. We need a response to the answer at question 7.
Yeah. So question 7, they said Painted Horse Recovery provides culturally and linguistically specific services to the urban Native American population. We lead with culture, and we also have linguistic services in our meetings held at PHR. Our previously funded Multnomah County M110 location. We offer a sweat lodge, drumming, beading, and take clients to ceremonies to connect with culture.
Thank you for that. And Painted Horse Recovery applied for $4 million in peer support. And our questions around peer support are the services associated with SUD or treatment words or some other piece that Painted Horse might not have applying for Measure 11. I'm sorry, ballot Measure 110. That was a slip on my side. And are the peer support services field-based or office-based?
So from the budget, most of the funding is a large chunk of it goes towards salary and personnel. And then the other large chunk of it goes towards kind of like what I think we've seen things that would fall into like the program part of a budget. Like utilities and occupancy and supplies, vehicles for outreach and engagement. So they have a resource center, but it also indicates that they go to events and do engagement in the community, and their budget reflects both of those pieces.
Thank you. Questions about that? Clarification? Thank you. And that organization applied for one service area, so we can move on to Pathfinders. Before we close, we're going to do at least Pathfinders and Reclaiming Lives, so that David is not here, Jude is here, Reclaiming Lives is Kathy Cervantes and Juliana Witcher. So, Jude, you're on deck for Pathfinders.
Okay, so the Pathfinder Network, they are not the CMHP. Their answer for question number 7 was recognizing that communities of color are overrepresented in the criminal justice system. We prioritize culturally and linguistically responsive services and staffing informed by principles of diversity, equity and inclusion, justice and belonging. A representative number of our direct service staff are from communities of color, and we have lived experience similar to those we serve. We have bilingual, culturally responsive, and gender responsive peer positions. Staff in each of our peer support programs and across the agency provide services in Spanish, We have translated our marketing materials and program documents into Spanish to improve access. We use Linguava, and maybe I pronounced that wrong, a virtual interpretation service that enhances accessibility when communicating with our participants and their families. Linguava offers comprehensive range of services, including telephone, video, and American Sign Language translation, covering over 230 languages. We have enhanced our outreach strategies and are conducting targeted outreach to communities most impacted by the criminalization of addiction, intergenerational trauma, and historical lack of access to services, with a specific focus on Latinx, Black, and African Americans in Indigenous communities. This includes providing information at applicable community provider meetings and tabling at community events specific to these communities. By focusing our services on those who are involved in the justice system, we will be able to target more participants who are impacted by the, hold on one second. Oh, I ended up shutting that by accident. Sorry, I shut my document.
It's all right. We got you.
Everybody can take a breath while I go down. Most impacted by drug use and the war on drugs. Our focus is on helping community members build individual social and community resources that prioritize access and promote more positive outcomes for people and communities who experience a higher burden of disease. Operating from a peer-driven service model, we reduce barriers and improve outcomes by uplifting the value of lived experience in supporting participants as they navigate pathways previously traveled by our skilled workforce. Without this funding, sustaining our programs would not be possible. So they have applied for one service area, and that is peer support. Let me get to that. Peer support. So they do not bill Medicaid. And so in their application, they are asking for support to do wraparound and drop-in peer services across a continuum of peer support services that are aimed at increasing access and removing barriers to improve outcomes for people who are struggling with substance use and addiction. They have a very comprehensive set of peer support services. Their agency has been operating almost 20 years, looks like, well, 20 years this year, since 2005. They're in multiple counties, and they have, it looks to me they were listing in their application, they listed the number of people that they have served in altogether and in the specific county. So they do mobile peer support, they do community outreach services, they literally go and meet people where they're at. They have evidence-based, gender-specific, cognitive behavioral groups and support groups that are facilitated by peer support specialists. They are looking to expand to include different types of peers to kind of continue to reach across that continuum. And I will look to see if they were funded. Let me see. If
they were funded before.
Yeah. So they really, it in my read of this agency, because I'm looking at the time, it looks like, you know, they are focusing on a population that has experience of criminalization because of the war on drugs, and are providing support services to help people get back on their feet and work with their families.
Great. Thanks for the summary. Our last application we're going to touch on before we close is Reclaiming Lives. Kathy and Juliana. They are not the QMHP. We know that. How'd they answer question 7, please?
Question 7, and just to be clear, you want me to read their answer to question 7?
Yeah, please.
Okay. And I don't speak Spanish, so apologies if I mispronounce this. They run a program called El Camino Seguro. El Camino Seguro is a culturally specific long-term recovery, peer support, and outreach program for Spanish-speaking individuals. Launched in 2022, it is the only peer support recovery program in the county that offers bilingual staff and peer mentors. The presence of peers who understand the cultural nuances of the Latinx community is vital for building trust among participants. Individuals join recovery circles led by peers with lived experience, allowing them to connect with others on a similar journey while conversing in Spanish and enjoying authentic Mexican food. This fosters a sense of cultural validation and support. All printed materials, brochures, and presentations are provided in Spanish and tailored to reflect Latino culture. There is an emphasis on family with the addition of the first Al-Anon group in Spanish in our area, where family members find support while their loved ones participate in their recovery.
Thank you. I'll work us through this unless so screening and assessment is said they did not apply for, but they also are applying for $2 million for peers. Can you summarize what you mentioned El Camino Seguro, that the peers are in that program? Can you say more if they're office-based, field-based, kind of what?
Yeah. Just want to correct myself because I think somebody had asked in the last meeting where Reclaiming Lives was discussed if all of their services happen in office or if they do outreach in the community. I had said that it mostly occurs on their campus, but I did read again more carefully. They did note that another significant focus will be offering recovery circles at local migrant work camps. So they do, in fact, actually go out into the community. I'm trying to look for other relevant information. Under question 5, when they talk about people most affected by the war on drugs, they also mentioned as the only community recovery center with bilingual peers and staff, Reclaiming Lives is uniquely positioned to reach the Latinx community, which is the county's fastest growing demographic group, and is the second largest demographic group in the state enrolled in OHP. Another thing I'd like to know about them is their fiscal and technical narrative started with questions 3 and 4. It appeared to be, I don't know if they just didn't answer them or if they didn't turn it in, but questions 1 and 2 about billing Medicaid were just absent, and my single point of contact just recommended that I score it at 0 and turn the application in. So I do see that they're at an 8. They would potentially be at a 12 if they had answered those questions. It was, I just get the feeling that it maybe just didn't make it onto the document, but since it is pure, I mean, just offhand, none of the stuff that they described seemed to be billable for Medicaid.
Okay. That's really helpful insight. Thank you for that. Anything else to share, Kathy?
No,
Okay.
Juliana covered it pretty much, and yeah, it did look like they only had 1 page sent in for their fiscal and technical narrative, and it started at question 3. So I just don't know if they didn't get uploaded.
Okay. All right. Any other questions for your fellow panelists before we close? Seeing none, I have, and I just lost my tab. I was going to call on the folks and make sure you know you're on deck for this afternoon. We're coming back together in an hour, so please go eat, fuel your bodies. But we will be moving to Rogue Community Health, Stab and Wagon, Fourth Dimension, True Colors Recovery, Youth Era, and Oregon Recovers. So that is our goal. To get through this, and I would really encourage everybody to reflect on what you heard so far today. and to look at the potential starting places that we provided last time, so we can move into recommendations for Jackson County, and then revisit Hood River, which I believe was our plan. And please know, as the agendas come out, it is, also subject to change, because these are very hard conversations to get through together, with over 40 of us in a room. And I really thank you ahead of time for being prepared to lean in. I think moving at this faster clip is going to get us to a thoughtful, fast decision, fast-ish. Thank you all. Unless there's anything else to say for the good of the order, we will close for an hour and come back here at 1 o'clock. Thank you.